Hi, everyone, and welcome back to the symposium. Welcome to Healthsciption with ACE Fitness and Dr. Sears Wellness Institute, Merging of the Greats. I am very excited to have Cedric Bryan, who is the President and Chief Science Officer of ACE, and Dominique Hodgen, who is the Executive Director of Education of Dr. Sears Wellness Institute. Now, we're so much more than titles, so I would love the two of you to tell us a little bit about yourselves. Cedric, why don't we start with you?
Well, why don't we start with Dominique?
Why don't we? Let's start with Dominique.
Well, just because I know my mom would be upset if I did anything other than that.
We got to make mom happy. Dominique,
That's right.
with you.
Funny. So my name is Dominique Hodgen. I am actually currently the Vice President for Health and Wellness for the education for ACE Fitness. And my role is basically helping run the new division of the Dr. Sears Wellness Institute that is now under ACE Health and Wellness. And so we focus on training and certifying health coaches to help empower them to learn everything they need to learn, especially the behavior change side of things. And then we help them launch successfully so that they are empowered to go out and help as many people as we possibly can.
I love that. Happy and healthy humans.
Right.
Cedric?
Yes, well, thanks first, Marina, for inviting us to be able to participate in the symposium. I'm Cedric Bryan. I'm the President and Chief Science Officer for the American Council on Exercise. I've been with the organization for over 20 years, and we have a simple mission, and that's to get people moving. And I think because of our name being the American Council on Exercise, many people misunderstand what we mean by getting people moving. It's more than just simply getting people to move and be physically active and exercise. It's really getting people moving toward adopting and maintaining healthier lifestyles. And so we've been committed to this idea of healthy lifestyle behavior change as really being an important component of contributing to an enhancement in public health and addressing some of the challenges that we face with chronic conditions. And so that's why we've really been excited about our new family member, Dr. Sears Wellness Institute.
We are all very excited about your new family member. And I think this is a good segue into the heart of what the session is about. So we all saw the press release and it was really exciting, but there's been a lot of questions. And I know I've asked this question and I know they're still floating around. What does this really mean? What is this merger exactly? What inspired it, and how will it affect coaches who are already certified by Dr. Sears Wellness and ACE, and those who are still looking to get their certification? That's a lot of questions. So
sure, that is
inspired.
I'll try to tackle that, and Dominique, feel free to weigh in where you deem appropriate. I guess in terms of how did we get here, one of our organizational values at ACE Fitness is collaboration and connection. And we always look forward to taking advantage of the opportunity to work with like-minded organizations that kind of share our mission, our vision, and our values. And ironically, Dominique and her better half, Bob, who is really the CEO of Dr. Sears Wellness Institute. We had the pleasure of meeting them well over a year ago now through a mutual friend. And we just seemed to connect right off the bat, I think, because we had shared values. We just had a similar vision for the health coaching space. And so our initial discussions really centered around how might we be able to work collaboratively to bring about more change and impact. And as the discussions continued, we kind of, if you're going to use kind of the relationship analogy, we said, well, let's go from dating to becoming engaged and ultimately getting married. And so we're married now. And we've come together as this team that really is committed to raising the bar in terms of what's happening in the health coaching space. But more importantly, we want to serve as an example to all of the various organizations that are out there, that if we come together and work together, we can accomplish more and really have the impact that I think the public deserves and needs. Because if you think about all of the statistics out there, and things have only gotten worse with the pandemic in terms of chronic illnesses, mental health challenges, all of these various things are weighing our society down, are really a burden on individuals. And in our humble opinion, it's organizations like ours being able to deliver the services that we can through the professionals we have the opportunity to educate and train, that can really make a significant impact in reversing those conditions. The WHO, just in a couple of weeks ago, they released their global report on physical activity. And as one would expect, those numbers were pretty atrocious in terms of people know that it's important, they believe it's important, but it's really difficult for people to take those good intentions and that belief and that knowledge and put it into practice. And that's where individuals who are skilled at health coaching, who can come alongside and be that trusted guide, that supporter of those individuals on that challenging journey of lifestyle behavior change, can really help kind of translate all of the mounds of evidence that we have to support all of these healthy lifestyle behaviors, whether it's better nutrition, more activity, stress management, better sleep, all of those things. I think most individuals would say, yes, I should be doing those, but they have a very difficult time making it happen. And it's the work that people like Dominique and members of the DSWI team have been doing for quite some time with the folks that they educate and train, helping them to be those resources, those trusted guides for those individuals in the public who want to make these changes.
Beautifully said, and agree. Absolutely. And having known Dominique and Bob for a few years now, I, again, agree with you. Mission and values, it's all there. So congratulations. I can see what you saw in DSWI, and I can see what you saw specifically in Dominique and Bob, because we don't work with logos, we work with people, right?
That's right.
Yeah, it's absolutely amazing. Now, I love what you said about how you want to accomplish more. And I'm all for that.
Mm-hmm.
But what does that more mean, right? Because ACE Fitness, you've had a health coaching certification. Dr. Sears Wellness has a health coaching certification. This coming together, what does that mean? How do we accomplish more? Does anything change on either side? Can you shine some light over here, maybe?
Sure. As you mentioned, we both have health coaching credentials. The other thing is that we both have a fair number of certified health coaching professionals. Coming together, we virtually double that number of professionals, so that we have anywhere from 15 to 20,000 professionals from the combined group. So that gives us power just in numbers of individuals that we can influence, who can exert that influence out in the community. And also, we are able to bring together a much greater array of resources and courseware and products that we can offer to individuals. Because really, if you think about it, health coaching in many respects is a lot about giving people choices and options so that they can find what works best for them. And we believe we want to do the same thing from an education and training perspective. We want to be able to give people a wide array of options and choices so they can select those things that are the best fit for their professional lifestyles, if you will. And so that's really when I say accomplishing more, is being able to reach more people to move more people.
Like that, reach more people to move more people. I love that. Dominique, do you have anything to add to that?
No, I agree. I think that choice is a huge factor. And I often tell people when I'm talking to them on the phone that it is, what we do here is we're not here to sell you. We're here to coach you, help you decide what's best for you, what classes are going to help you meet your own professional goals. What do you need support in? How can we best meet those needs? And so what Cedric said is spot on. It really is allowing anybody who comes into our space to really find what is going to be the best fit for them at that moment and what they are looking for, and helping them achieve their own personal goals for their professional life.
Do you have a lot of new coaches that are approaching you and asking these questions, or is it more of the ones who already been certified and they're looking for something more?
No, I mean, there are always new people coming into the space. A lot of times it's because they don't even, this is the first time they've heard of coaching, right?
Yeah.
Might not have been something that crossed their mind. They might be in a profession where health coaching hasn't really been talked about, although it is more and more, right? It's definitely kind of on a wave right now where health coaching is starting to gain more traction and get more awareness out there. And people are starting to understand what the definition of a health coach is, because that was a little bit novel several years ago. People were like, what is a health coach? And that's becoming more and more clear. And I think that that is opening the door for a lot of people to really explore, like, what does this mean for me? I'm already in this role. How do I, if I add on health coaching, what does that look like? Or I'm in a role, but I'm really ready to shift gears and I want to just do health coaching because I'm passionate about helping other people. And so that is really a big part of it. So I think the market is expanding. I mean, we're definitely on a trajectory for a huge amount of growth. And especially like what even Cedric said earlier, is there's a lot of opportunity that people hadn't thought about, like, oh, a health coach could actually work in a corporate space, or they could work in a medical facility, or they could work in a country club, or wherever. You know, truly, when people ask me, well, where do health coaches work? My answer is anywhere there's humans. Because every human needs a health coach. So anywhere there's humans, there's an opportunity for a health coach to be employed.
Amen.
Yeah. I mean, it's amazing that this industry has been around for over 20 years, and just now it's starting to gain some traction, and now we're starting to hear about it. And really the theme of the symposium this year is demystifying health and wellness coaching, because there's still, even amongst health coaches themselves, there's so many different definitions of what a health coach is and what a health coach does, and really even that scope of practice, right? It's still so unclear to some. So to me, that actually, you know, with the merger of both of your great organizations, that scope of practice expands as well. What do you think?
Well, it certainly does for those individuals who might possess another credential, whether it's, you know, if it's a fitness professional also acquires a health coaching potential, then what they can do on the fitness side can expand. Same thing if you're a nutritionist and a health coach, or a nurse and a health coach. And so that is very true. And one of the things that why this kind of coming together was so important to us as well, is that we recognize that if we want to help our exercise professionals experience a much greater amount of success with their clients, it's really helping them to develop and acquire health coaching skills. Because one of the things that I think has happened too long in the fitness space is that we have this expert client mentality, in that I have all this exercise science, knowledge, and information, and I'm going to wow you with the science, and I'm going to tell you what you should be doing. I'm going to tell you what zone you should be working in, and tell you how to get the greatest benefit from your resistance training, et cetera, and so forth. But we forget, to Dominique's point, we have to learn how to connect with other humans and be able to establish a trust relationship, so that we earn the right to be heard and recognize that the client is the expert with regard to their lives, not us. And so we really want to kind of transform the viewpoint that our exercise professionals have. So it's not just about our health coaches, but it's about all of our exercise professionals being upskilled to really provide better service and support to the clients they already have.
Right, that holistic approach.
Exactly.
That's probably the biggest differentiator when we're asked this question all the time: what is different between a health coach and a therapist, right? So a health coach, a client, that's who drives the change, that's who drives the conversation.
Exactly.
Yeah, we talk about this all the time, the biggest difference. Now, the title of this session is Healthsciption, right? Not a prescription, but a Healthsciption. Where do you see a health coach and a fitness specialist as part of a health and care team? Is there room for both? Do you feel that health coaching and exercise should be something that's prescribed by a doctor? I would love both of your perspectives on this one. Dominique, maybe we'll start with you on this one.
Sure. So, I mean, health coaching has been kind of weaving its way into the medical profession for a while now. There's a lot of medical professionals who realize that they need those coaching skills, right? They're kind of in the same boat. Medical professionals are in the same boat as fitness professionals, right? They have all this great knowledge, they're sharing it with their clients, but then their clients aren't doing anything with it, right?
Yep.
And when a patient goes to see a physician and they're dealing with a chronic disease or anything like that, they're getting there and the doctor's like, well, you should diet and exercise. Bye. And then they're off on their own and with no direction or support. And so with health coaches, and a lot of health coaches, especially with some of the new changes in the industry, where now, you know, they're working towards reimbursement with health insurance companies, and they're working towards a higher, meeting higher standards in the industry as a whole. They are able to now come alongside, health coaches are able to come alongside medical professionals and provide that communication avenue for medical professionals, you know, basically prescription to make it into a healthscription, right? Just like you're saying, where it's let me show you how to implement this stuff. Let's work together. Let me guide you in the process of how you're going to implement these new things in a way that works best for you. So it's a sustainable model, right? A lot of times people think, well, it's just a short-term fix, and it really is something that needs to be a lifestyle. We talk about it all the time in health coaching. It's a lifestyle. It's not it's not a diet. It's not, you know, one size fits all. It's just figuring out what works for you so that you can be your healthiest best, achieve that optimal wellness, and for the long haul, not short term. And that's how we get rid of chronic disease and how we get rid of some of these other problems that are happening out there. But health coaching has really started to step into the healthcare world. And even, you know, and I've even seen over the last couple of years, the number of physicians and nurses and registered dietitians and nutritionists coming into our training to get those skills because they know they lack them. They know that when they went through medical school or nursing school and they got one semester maybe of dietetics, right, that they are missing a lot more information, not only on what to share with their clients, but how to share it with their clients, right? And I'll get nurses oftentimes at the end of their training with us saying, thank you for teaching me how to talk to my clients, how to talk to my patients, so that they actually do what they need to do to achieve their optimal wellness. That was a skill that they had never learned before. So it's definitely moving into the healthcare profession, and I think that it is very needed and being very much more well received now than it has been previously.
I think the key here maybe is to understand that a health coach does not replace a doctor, does not replace a nurse practitioner. It's a part of that health and care team, because we're so used to that quick fix. You know, we only go to doctors when something is really, really bothering you, and there's, you know, we go for acute things, right? But health coaching, it's not a pizzotto. It's not a quick fix. You're not going to go to health coach say, hey, what do I do now, right? It's a relationship. So I think this is where a lot of education probably comes in as well.
Yeah.
It's
teaching them what to coach and how to coach.
Yeah.
And I would say that I think you can make a strong argument that healthcare is the ultimate team sport. I would say optimal healthcare. Let me rephrase that, because I think you should have a lot of different players and positions that are represented as part of that healthcare team, from an exercise professional, a health coach, nutritionist, physician, various other healthcare professionals, whether it's a physical therapist, if they have some type of orthopedic issue, that are all working together with that patient at the center, and really making sure that we are supporting and empowering that person to make whatever the necessary changes are gradually and progressively to become their best selves. And I really believe that the health coach can kind of serve as that bridge that bridges the clinic to the community, if you will. And that what oftentimes happens is that you go in, you see a healthcare provider, you don't have a ton of time to really talk about a lot. You get told a fair amount in that short period of time. We'll tell you what your blood pressure was, your temperature, those types of things, and we'll tell you need to do this and stop doing this, and you leave that office visit with, wow, I've got to work on this, I've got to avoid that. Where do I start?
Yeah.
How do I begin this whole process? And that's where, if we really take this kind of team approach, the health coach can serve as that bridge to help that person when they go back into their real world, into the community. They have someone that understands their challenges and their issues, is going to work collaboratively with them to put into practice and implement what the healthcare provider is instructing them that they should be doing. And we've seen examples of that working well, whether it's things like the diabetes prevention program, which has been quite effective at helping individuals in terms of managing diabetes and so forth. It really is, it's a behavior change program.
Yep.
And I think we're seeing more and more examples of that model being quite effective at helping people make these meaningful changes. And the important thing, and Dominique mentioned this, is that making sure that those changes are sustainable.
Exactly. Totally agree on all points. So we talked a little bit about a trend is health coaching is up on a rise, and health coach is becoming an integral member of a health and care team. What are some other trends do you see emerging? Dominique, maybe let's start with you.
We're seeing in our space, and I'm quite actually excited to see it. It's one of those unintended positive consequences of the pandemic in some respects, is that in the fitness space, there used to be, I would say, an unhealthy obsession with body weight, weight loss, body image, and so forth as the reasons as to why individuals would think about being physically active. And one of the things that we've seen that's been a pretty significant shift is that individuals are more focused on mental health, stress management, how they're feeling overall, as opposed to what does the scale tell me, but really more in terms of how am I managing life. And I think all that's going to do is it's going to help individuals to recognize the important need of developing the skills that really are central to health coaching.
Yeah.
Yeah, and I'll echo that. I mean, I think that stress management is a huge opportunity right now, and people are more aware of it.
Mm-hmm.
I think that, they're realizing that, wow, I'm different than I was a couple of years ago, right? My priorities have shifted. I'm struggling with things that are different. I'm learning how to work remotely from my job. I'm trying to juggle more stuff with my kids. It feels like there's just a lot more pressure out there for them to try to figure things out. And so that's a huge need. One of our biggest requests is they want help with stress management. And that also is definitely in playing, and corporate wellness has been out there for a long time. But it has definitely increased its interest in health coaches to help support their employees, right? Because when employees are stressed, what happens? They take time off. They're not as productive at work. There's all these kind of ripple effect factors that happen. And it's so hard for employers to have good quality employees and hold on to those employees right now anyway, just because of the dynamics of our world. And so if they can bring in a health coach to help support their employees to be healthier, to have more focus, to be more present in their jobs, to do better, it is a win-win for everyone. So I think that stress management is a big factor that I'm seeing across the board with our industry. And I do think, and it's also another trend that I've kind of seen is, we've talked about health coaches coming into healthcare. I've seen a lot of healthcare professionals saying, I'm fried. And I need something different. Yeah. And we'll talk to healthcare professionals, and they will be, you know what, I've been doing my job for 5, 10, 15, 20 years. I'm burnout. The pandemic just really kind of did a number on me. And I've seen so much. I hear a really common thing that I hear from nurses are, I want to be out of sick care and I want to get into healthcare.
Mhm.
So I don't want to be where people haven't taken care of themselves and we're trying to put these pieces back together for these lives that have just fallen apart in their health. And let me get on the side of prevention. I want to get there before they get to where I was having them, in my previous job. So I have a lot of healthcare professionals are looking at getting onto the prevention side. They've seen a system that isn't as effective in helping people repair their bodies as it is to preventing the illness in the first place. So that's another trend that I've seen for sure.
I agree more with what you were saying about stress and anxiety. So as your coach, we have a lot of our clients are large employers and health coachpreneurs in our platform. We provide them opportunities to work with those clients. And whenever we talk to those large employers, we always ask the question, well, what do coaches specialize in? What do clients usually ask for? And the interesting thing is, it's all about stress and anxiety, but it exhibits itself in very different ways. So somebody will come in and they'll say, I've lost a ton of weight. Somebody will say, I can't sleep. Somebody will say, I procrastinate. I've never procrastinated before. And when you drill down to it, when they actually start talking, it's all about stress and anxiety. And it is such, I mean, not all, but a major part of it, right?
Yeah.
Yeah, it has impacted us all so much. And until we start talking about it and start figuring out what actually happened, right? It's just always in the back. And we think it just manifests, we can always put a Band-Aid, right? Sleep, you can take medication, but is that really going to accomplish what you want to accomplish, right? So I couldn't agree more.
Yeah. And I think it's important too as coaches out there coaching these folks is like, you're not broken. You're not the only one on the planet.
I'm not going to fix
like
you.
this.
Yeah.
You're not alone.
Yeah.
There's lots of people struggling with this. We just need to figure out what's the best way to help you get back to where you want to be. Right. That's the coaching aspect, is figuring out because food does impact our stress and our anxiety and our mental health, and exercise impacts our mental health and our anxiety. Like all of these things that we do as health coaches have a direct effect on our brain, and our brain is where mental illness comes from, or mental health issues come from. Right. So if we can fix our brain and we can talk through how to manage some of these things and put them into attainable goals, right? Not SMART goals, as we say in health coaching, right? Not just, I wish I could, or I try. It's helping them put real goals in place and then walking alongside them saying, I'm right here with you. I'm walking alongside you this entire path. So you are not alone. You are not by yourself. Yep. You're going to set the goal. You're driving the bus. I'm just here to help you. And that just empowers them to feel not alone and to feel like they can be successiving.
And Marina, you triggered a thought for me when you had mentioned you made reference to YourCoach and your platform and so forth. And I'm giving you guys a plug here because one of the things that I think has been another consequence of the pandemic is that with telehealth and things that we're seeing, I think there's much more acceptance of using technology as a way to establish these connections. And so platforms like yours, I think, are going to be more widely used by health coaches to provide and offer their services, which I think is absolutely terrific because it expands their abilities to reach and impact lives.
Absolutely. Obviously, I couldn't agree more. Thank you for that. And it's about, it's hard to make a connection when you're not with somebody in real life. And there's been a lot of coaching that it's been called coaching, but it's just text-based. And we call it nudging because without that real connection, without that first conversation with the live person to know that there's somebody truly is on the other side, then you can text, then you can message. Absolutely. That's part of it. But to begin, that connection there is nothing like it. So thank you for saying that.
It's human to human,
It's a human. Yeah.
It's human to human contact.
Yeah. And at the end of the day,
relationships are a huge part of our healthy behaviors, right? If you don't have relationships, that's a factor, right? So this is a relationship that they can have that's in a safe space, non-judgmental, support-oriented, encouraging, and positive, right? Based on positive psychology. How do we meet where you are right now and help you get to where you want to be? It's not about drudging up things that didn't work. It's like really keeping it positive, and that just empowers them even more.
Couldn't agree more. time is truly flying, so we do need to wrap up here.
Sure.
I do have a question for you. So 2023, merging of the greats, why DSWI? Why ACE Fitness? What should we know? Where are we going? What are some final words that you want to leave us with?
Dominic, I'll let you start and I'll close. How's that?
Okay. Yeah, I mean, 2023, sky's the limit, right? I mean, there's just a much bigger opportunity as we have come together to create not just 1 + 1 is 2, but 1 + 1 is 3 or 4, right? How do we raise the bar, set those standards in place, and so that we are really giving anyone who wants to be a health coach everything they need to empower them, right? Not just education, but practice, practical application, real world experience. That's what they're getting in the training, and we're empowering them to move forward, whether they want to work for a company or be self-employed, whatever they need. That's what we together are going to be able to do, is to help get them where they want to be as coaches, right? Who do you want to work with? Where do you want to be? Where are you passionate about, right? How do we help fuel you to move that forward? And so I think that there's just a lot of opportunity in 2023 that we've got on the horizon.
You know,
Yes, I couldn't agree more, because just when you look at the big challenges that are ahead of us, whether you're looking at chronic disease, whether you're looking at mental health, whether you're looking at the obesity epidemic, quite frankly, there's a physical inactivity epidemic, and all of those things require the ability to help individuals navigate the challenges of change. And so what really excites us about these two fine organizations coming together is that we are going to be able to assemble quite an impressive array of resources that are going to allow individuals to get the knowledge, skills, and training that they need to be able to put into practice the skill set and arsenal to help come alongside individuals on those journeys of change. And the other thing too, in terms of that choice, we've been talking about choice in terms of the types of education, perhaps from a topical standpoint, but also from a learning style standpoint, in that we have things for the kind of more self-directed learner who learns quite well independently. We have offerings for individuals who need that arm around my shoulder and that more guided experience, more like a classroom style experience. So, because we really want to give people all the options to be in the best environment to ensure that they're successful in being able to have an impact with their clients.
I appreciate that. Dominique, you mentioned passion, and I see passion from both of you. I am so excited about this merger. I'm so excited about 2023 for both of your wonderful organizations. And I know the sky is the limit, and I, for one, cannot wait to see what the next year will hold. Thank you both so much for being here with us. Dominique, Cedric, it's been so much fun, and we'll talk again soon. Thank you.
Great. Thank you, Marina.
Thank you.